So it's important to note that Mbale Regional Referral Hospital is a government-aided hospital. And it's one of the 24 sites that is in the registry. And we are serving over 4.6 million people in about 16 districts in Eastern Uganda. This is a big population, but because of the ICRU, we have been in position to reduce the mortality despite the big catchment area. This hospital started in 1924 as a center, and it has grown to 470 bed capacity. But however, not until March 2019, when critical care services started in the hospital, which was initiated by Dr. Adam and Matthew. These people were on placement, and they identified the need for critical care services. So this is part of the team that work in the ICU. As we go on, we shall see the setting. We see that being one of the training hospitals that is covering, that is surrounded by many training schools, including one of the public universities, Eastern University. It has 4 anesthesiologists and 7 nursing staffs. And out of the 7 nursing staff, most of them have trainings in critical care, with 1 nurse with a specialty. Sorry, the slides have gone off. Okay, thank you. We also have anesthesia students from Eastern University. These ones really play a very good role in bridging the gap in the provision of care to the critically ill patient, since ICU is a team work. We also have surgeons who are 4 in number, with residents and medical officers, and the junior house officers who are on your unit 24 hours. Currently, this is how the current HDU ICU of Mbale is looking like. It's a 5-bed capacity, but we are in position to intubate and mechanically ventilate a maximum of 3 patients as per now. But a bigger future ICU will be in position to have 20-bed capacity, which is in few years' time. So, as I mentioned earlier, the ICU HDU, we have a 5-bed capacity. And we have been previously been able to ventilate 2 patients, but we got also a pediatric mechanical ventilator. So currently we can intubate and mechanically ventilate 3 patients. It's also important to note that dialysis services are also available in the hospital 7 days a week. And this has really helped to reduce the rate of mortality and the financial constraints to the patient who need constant referrals to Chirudu and Mulago. Now, which kind of patients are admitted in the ICU or HDU of Mbale? We mostly admit postoperative patients of all age groups who meet admission criteria. And the admission criteria here, we talk about any patient who scores ASOS above 10 qualifies to be admitted in the ICU or HDU, because these patients are most likely to deteriorate. 2, any patient who has a GCS of less than 8 is admitted for airway protection, because you realize that a patient of GCS less than 8, they may not be in position to protect their airways. Then, besides the postoperative patients, since it is a general hospital, since it is a general ICU, we also offer services to the obstetric mothers who may be having complications and they need any support in regards to the ICU. Pediatric and medical admissions are rare due to bed capacity, but we are glad that as time goes on, the bed capacity is going to increase, and these people shall benefit from the services. So this is the current ICU. It is still in progress. If it happens to be completed, it will be a 20-bed capacity, and what we are seeing shall only be housing the ICU, not the HDU. HDU will be in different wards. From some of the data that the team managed to extract from January of 2025 to December, we realized that we had a total of 299 patients admitted, and out of this, 60% of 299 were male, and this could be attributed the fact that since male have a poor health-seeking behavior, some of them come to the hospital late, and when they are worked on, you realize that they are in critical condition and end up consuming much of the resources. Yes. And out of this, the age group of 20 to 40 years had a percentage of 29%. It's a young age, so we realized that these ones also benefited a lot. But out of the total, we are able to have 49 patients. This patient, the 47 were mechanically ventilated, so which represented a percentage of 16%, which is far below the average, but at least it is significant. That shows that we are making use of the service. And around 21% passed on. So we were in position to save 79%, which is a plus for the team. That's what we managed to extract. But in the introductory part, we say that most of the patients that we are admitting, they must have undergone surgery. The priority is given to those ones to prevent the complications, although other types of patients can benefit from this. So what experience has the team gotten with working with ICRU? So it's important to note that ICU is a marathon and a sprint. So marathon, because when you are working in ICU, at the end of the day, you go back when you are really tired, but it requires a lot of endurance. But again, you don't go back the same, because there is a life which has been saved. And besides that, as a team, we have been in position to gain clinical and technical competence, because as opposed to other patients, an ICU patient really needs constant taking of vitals and documentation. As someone was saying that they are here as generators of data, we are also telling you that the data entrants who are also serving as nurses, we are also generating data because we are constantly taking vitals and recording it. Then, because of many machines, the ventilators, the patient monitors, we have been in position to gain some experience on how to operate some of them and interpret. And by so doing this, we can be in position to identify deteriorating patients quickly. Secondly, emotional and psychological dynamics. ICU is so draining. Each and everyone, the ones who are taking care of the patients, even the caretakers and the patients themselves, they have emotional distress. So it has really taught us that we are working with people who are not having only the condition that they are having, but they are also having fear of the unknown. So we have been in position to control our emotions. We talk to them, family conferences, and by so doing this, we have gained skills. Then communication and environmental reality. It is a teamwork. So when I am a nurse, I have to advocate for my patients as well as collaborating with other team members. So as an experience, it becomes very easy for me to break the walls that may hinder my communication with other team members. Then professional career and launchpad. Yes, we have not just been data entrants, but we have been in position to build our career basing on what we are generating and basing on different people that we meet along the way. Even now here, I'm sure we are not going to go back the same, having come to this environment and brought out what is happening in Mbale. So I, on behalf of the data entrants of Mbale, we are grateful for ICRU because we have not remained the same. We have gone 1,000 miles by doing some extra work outside our nursing duties. Thank you for listening. I also add my voice on appreciating the team that has been there to generate data, to enter data, the sponsors. You have really done a good job, not forgetting our team leader. Thank you so much.